Can you give us a list of the oral meds that we need to know?
Yeah, so metformin for sure, glyburide, and yeah, they're kind of weird spelling, you know. Metformin is super popular. You guys will probably see this in the hospital. Really popular because it's cheap, really inexpensive for patients. Glyburide is another one that I would like you to know. Byetta too. So just quickly, what is metformin's primary action? I know it does like a lot. You're thinking glyburide. Stimulates the pancreas. Right? Yeah. I would think second guess myself. So this one stimulates the pancreas, you're right, the beta cells, to release insulin. And metformin decreases liver glucose release or production or whatever. So it lowers your glucose levels. And then Byetta decreases appetite and decreases glucose as well. So it decreases glucose and it inhibits.
These are all for type 2.
Yeah. Yep.
Isn't Byetta a shot?
Yeah, so that's the only one that's not technically an oral hypoglycemic. It's a sub-Q injection. And it's for like people pre-diabetes. Like I have a cousin who's kind of overweight, and he would be someone that would probably be considered to have like metabolic syndrome, like on the edge of diabetes, and he uses Byetta.
Could you use metformin for that, or no?
I don't know.
Or is it usually just...
I don't know.
Do you need to know Januvia?
I don't remember that. But it's like the same thing as Byetta. It's just an oral version of it. So if you just remember that it's the same thing as Byetta pretty much.
So, would metformin do any good for a diabetic patient who still ate sugar and like wasn't on a proper diet?
Maybe at first, but then there's going to be a point in time where it's not going to work anymore if they keep going down that path. So probably not.
Okay.
Like unless they make a drastic change and start eating better and exercising, these will not be sufficient. They're going to end up on insulin.
Okay.
And like there's a little wheel that kind of talks about like diet, oral hypoglycemics and stuff. I kind of drew an arrow because it's like first we tell them to eat healthy and watch their diet, and they don't do that. So then we have to put them on oral hypoglycemics, and then they still don't make the changes necessary, and then they end up on insulin. And so it's like people, it's sad, but they really aren't willing to eat healthy and work out and stuff like that. So they get diabetes.